My specialty is nutrition and dietetic science. You can get me at Chambogo University here in Uganda, at the Department of Nutritional Sciences and Dietetics, and specialize in, of course, teaching, research, and many consultancy services in regards to nutrition and dietetics. But really, it's more of research work and teaching. So I've interacted with a number of you before, and me, you know how we always proceed. It's an interactive class that we have to always be there to say something, not just to be quiet. So maybe I should know a few people as we proceed. Yudes Yangi, tell me more about Yudes Yangi briefly.
Thank you. Yangi is a student for BNED, first year, second semester. And currently, I'm in South Sudan. I'm in South Sudan. I filled a place called Djibouti County as a nurse.
Okay, that's wonderful. That's wonderful. Okay, Lual, are we able to see the full screen now?
Yes, Daniel.
It's really about health and nutrition and health economics, I believe. And today we are basically going to go through introductions and key concepts in health economics. And because we have to understand, as we are going to be health practitioners, or you're already practicing, you have to realize that there's a lot of economics that we apply out there, and we are going to understand when we talk about health economics. What are we talking about when we go in detail down there? So, of course, by the end of this, we would expect, or I would expect, that you all can know the concept of nutrition economics and its significance in public health and policy. I would also hope that you can describe the economic and health consequences of malnutrition on both individuals and societies. And I would also wish that you explain how improved nutrition contributes to economic growth and development. And of course, that one, we shall understand a few things on cost of hunger, and how much we talk of investment in nutrition can do for a nation. Like South Sudan, if you are to invest in nutrition in South Sudan, how much can a nation gain from it? So, of course, in nutrition economics, really, it seeks to optimize resources allocation to maximize nutritional benefits to the society. As you understand the concept of economics, as we are going to go over in detail down there, we realize that in health, sometimes we find that we have scarce resources, but the demands are high. So what we need to do is to use the little resource that we have for the benefit of the society and to maximize the health of the society. That is where the word health economics or nutrition economics comes in. So also the objective is operates at various levels, of course, individual, household, community, national, and global. And it is applied, the economics is applied even in the household. At an individual level, you're applying economics. Even elsewise, there are decisions you make, there are priorities you make in regards to your health. At some point when you have scarcity of resources, and you have to allocate it, you find that sometimes, or most times, you will prioritize that you are first healthy. So those individual decisions you make in regards to health that has, of course, financial implications. Most times, you find that you are already applying health economics. Of course, even in nutrition, you have to eat to be alive, and sometimes you have to spend. And in most cases, you would actually prioritize to be uh, satisfied before doing any other thing. If it is the last coin you have, maybe you'd want to buy now water and take so that you be hydrated. And you believe at the back of your mind, you believe that when you have eaten something, you will do much. So those decisions that you make in terms of food and nutrition access and making it available in your household are really in line with the economics in nutrition at individual level, at household level, at the community and at national level. There are also many aspects that we are going to see. Of course, it also nutrition economics also aims to address nutrition problems through economic principles and analytical methods. Yes, someone is interrupting. Can that person mute? Great. Uh, so, of course, most importantly, health is a multifaceted concept and is not easily measurable. That is what we need to understand. That measuring health is something that is not easy. And based on the WHO, the definition of
Yes, hello, sir.
if someone is raising their hand, tell me, is all fine?
Yes, yes, sir. There is a noise behind. I don't know from which side. There is a music.
No, even me, I'm getting the same. It means there is some interruption somewhere. I don't know
Yeah,
who's
yeah.
calling.
We never know. Maybe someone is not mute.
Coordinator, I think you will help us on that because it looks like there's
Sorry,
some
I'm going to
interruption.
control that. I'll be controlling that.
Great, great, great. Okay, so health is basically a state of complete physical, mental, and actually mental well-being, and it's not merely the absence of a disease. This states that, of course, for you to say that you're healthy, it doesn't just mean that you don't have the disease. And you realize that you have to be mentally okay, sound, you have to be physically fine, you have to be socially well. I mean, because if socially you're not fine, you find that there are many things that are bothering you. In the household, you're not okay. At your home, you have wrangles here and there. So, based on the aspect and the definition of health, we'll therefore say that you are not healthy. So, from today, you have to understand that health has to go along with all these different parts together. So, of course, it basically talks about how healthy people are, and there are various areas of measurements that I have highlighted up there. So As we proceed, we'll also want to understand healthcare. What is healthcare? Because we're going to talk about the health economy, we're going to talk about nutrition economics. But what is healthcare? Of course, as we know, some of you are working along the healthcare chain or delivery chain. Of course, we need to understand that the prevention, treatment, management of illnesses, and preservation of mental, physical, and social well-being through the services offered by medical and allied health professionals is what we actually term as healthcare. So someone said that she's a nurse. She's definitely offering that service. So she's promoting the health of our community. So she's contributing to what? To healthcare. And then we need to understand that healthcare is an important aspect of human capital. Of course, human capital is a technical term that can basically be simplified as the value of learning, the experience, and the ability embodied in workers, which increases productivity and income. It is a key word that, my friends, you need to know that you are here today because you want to improve on the value, your value. That's why we go to school. It is not assumed, but it is evident that if we go to school, we become more productive because we find many ways of doing the same thing. And sometimes we find faster ways of getting solutions. If we look back to the early 90s, where many discoveries were just being made, you find that the processes were long, and it took them many years to discover things that nowadays can be done within a year. So looking critically, that tells us that when we increase on our value, that translates to human capital, and it increases our productivity and income. And it is human capital that really contributes to development of a nation. So for that case, I believe the South Sudan doing a great job educating the nation is therefore improving the human capital and improving the productivity of its people and the ability of its people to make money and develop the nation. Another thing is the asset. Of course, these are values of things that you own or the valuable things you own, and it can accumulate and depreciate. So individual household can improve their health through the use of healthcare. Of course, diet is part. And another aspect that we have to understand is the production of health, where we shall understand the healthcare production function and determinants of health. So moving forward, we have to understand that healthcare, or there is an important difference between health and healthcare. I already talked about health being the state of physical, mental, social, and social well-being, and not merely the absence of a disease or infirmity. And healthcare being that process of prevention, treatment, or management of these health-related conditions, which is provided by the health care professionals or allied health professionals. So another thing that you need to understand that healthcare can be traded on market, but health cannot be traded on market, as we are going to understand the aspects of trade-offs in healthcare. Because you pay for healthcare and you receive the service, it can be traded on market, but health cannot be traded on market. Of course, demand for health care to improve our health, there's always a demand for health care. That is why we say it's always on the market. We have to demand for it. We have to pay for it sometimes, or most times. Of course, we also need to understand that healthcare markets differ from markets of other commodities. That is why we find that there are a lot of regulations in the healthcare markets. And Yondas will tell us that, or Yudas will tell us that she has had some level of education and professional documents for her to be practicing. So you realize that in the healthcare market, it differs from the market of other commodities because it is highly regulated. So this now takes us to another thing, and that is the health economics itself. So I hope we are following. Are we following? Do we have any question as we proceed?
Yes, sir. Yes, sir. We are.
Yeah, that is a problem when I put it full screen sometimes. Let me try again. So I was discussing really things which were in this slide. That's when I was talking about some of these concepts. I see that when I put a full screen, my slide doesn't move. But when it is like this, it is moving. So now that is a problem that we have to deal with here. So are we okay up to?
Yes, now we can see now healthcare. For me, I can see. Yeah, it's okay now.
Let's try to work like this. Yeah, I think this will work. This is better. So how far have you understood? Is there something you need clarification on? Are you getting something? Have you got the concept of healthcare as we go to now the economics?
Yes, we got the concept. We understand what healthcare is, an even definition of health.
Yeah, great. If we understand, then that's good. So Judas, is all okay?
Yeah, I think they'll say that I'm having music in the background, but it's not me. My place is quiet.
Yeah, no, it's not you. I realize because your audio is off. The video was the one on. I know the video may not affect much. Yeah, so that is the problem. So we are now going to health economics itself. I want us now to understand something on health economics. Good. So what is health economics? Which is why we are here today. We need to understand that health economics, of course, is basically a study of how the scarce resources are located to and within the what? The health economy. The health economy. How these scarce resources that we have are located within the what? The health economy. Because we shall never have enough. As someone says, man is a wanting animal because they will always have something they need. When one need is achieved, it ceases to be a need. Another one emerges. So that is it as human beings, and we shall always have scarce resources. So how we allocate these resources? And for example, in the health economy, is where the aspect of health economics comes in. Of course, we understand that the theoretical framework to help the healthcare professional decision makers or government to make decisions on how to maximize the health of a population given constrained health producing resources. We need health economics. Basically, it's aligned to that theoretical framework. Someone is muted. Please mute.
Phải năng lên cái gì? Nhìn đi.
Please mute. Mute. Someone can you
Kalau ayo ya komen.
Hello.
Mấy cái work. Cái bài luôn.
Lual, can you mute? Yes, Lual. Please let to say to benefit all of us. Let's be mute. So I was talking about health economic because now, if we don't stay mute, we divert people's attention. These aspects sometimes are technical, and it needs to be understood well. So, as we were talking about health economics, and we're talking about economics being the fact that we have in our communities scarce resources, and we need to allocate that resource to have maximum health benefit from that scarce resource. We have to apply the aspect of health economics. So there are people we call health economists. Maybe you want to be one. After understanding this aspect well, you can definitely contribute to the field of health economics as a health economist. So the health economist is that person who studies that aspect of utilization of scarce resources within the what? The health economy, or allocating the scarce resources within the health economy. So what do these people really focus on? They focus to understand the relationship between resources used and health outcomes achieved by alternative options and compare. So these people are always really studying how allocation of these scarce resources are impacting on the health outcomes of people in the community. So it's very important aspect, or these are very important people in any economy or in any country. There should be such people that will try to evaluate how the scarce resources are being used to maintain or to improve the health of the population. They also study the production of healthcare, doctors, specialists, or nurses. They are there always to evaluate how productive are these people, how are they delivering the services, are the doctors we have, because the scarcity can be even in terms of the nurses. We have few nurses in our healthcare, we have few doctors in our healthcare, we have few specialists in our healthcare system. So when I'm talking about the scarcity, don't think we are talking about drugs, or there are many things we may not have. Maybe the logistic, the vehicles to reach every community. So when I talk about the scarcity, we need to understand what resources are we talking about. So resources can be in terms of personnel, can be in terms of course, logistics, and many others. So these health economists will therefore understand the production of healthcare. Then they will also understand how to distribute, how we distribute healthcare across the population. How do we distribute healthcare across the population? That is always what they are studying, of course, based on who can pay or who needs it, or some combination. Because sometimes we reach a point whereby some healthcare services can only be received by people who can pay for it. But there's sometimes that aspect whereby who needs it the most. Then we shall talk about the aspect of the vulnerable population. Where the vulnerable population, we shall see the children under 5, we shall see the pregnant and lactating mothers, we shall see the elderly, we shall see people suffering from terminal illnesses. Of course, even there, they are priority. So who needs it the most or who can pay for it? They always study the distribution of these resources. Of course, when you find in a community, people who need health services the most are not receiving, then there is a problem in distribution. So the health economists also study how much money should the government spend on health care. Because if we understand the resources we have, we understand how many people will have to benefit from these services, then we have to make decisions, or we have to push the government to develop policies that can enable the community to receive enough of these health services. So that has financial implications. It will therefore translate into how much should the government spend on healthcare. So it's very important that this is understood. That is why we have the health economist to understand this. So, of course, the health economist, or if you understand this aspect of health economics, then there are many questions that should be ringing in your head right now. The first question would be, what role should the government play in health? Because we have understood the aspect of health economics, and who can be actually directly responsible for this? Of course, there are many levels. We talked about individual, we talked about household, the economy, or community. Of course, global, we have the World Health Organization that under the global health. And in Africa, we also have a body known as, there is also center, I think we have Center for Disease Control in Africa, the CDC Africa region. They also try to coordinate with the World Health Organization to manage the health economics and disease emergence in Africa. Of course, we have other bodies. And then, of course, when we come to individual countries, have ministries. There's Ministry of Health in each country. That helps, or it's the biggest body in the government, that helps in making decisions in regards to health. So, what role should the government play in health? What healthcare investment should a developing country make? Before making healthcare investment, of course, definitely you have to understand what resources do you have and what are the needs of your population. Then, what advertising should be banned? What is the optimal design for healthcare or for health insurance? Some of these key questions are what health economics can ask. Why has health care become so expensive? That question has to be answered. So it's like you might want even to do a study. If you're focusing on health economics, you can pick one of these questions and make your own and try to explore, get an hypothesis, and write about why has healthcare become so expensive. You want to understand if it's a problem in your country. So you would be contributing much into health economics because your findings will definitely help in one way or another. Does healthcare early in childhood lead to improved cognition and higher incomes in the future? These are questions that are vital for anyone outside there. And then another thing is, have Medicare and Medicaid increased utilization and improved health outcomes? These are really just health insurance programs that sometimes, almost times, other countries have used to improve on their healthcare delivery system. So another thing is, do different methods of doctor payment change quality of care outcomes or costs? So this really are just some of the questions that can come out of as you are going along this path. Moving forward, we need to look at the health economic problem. Of course, I will ask you, or the exam will come, state the health economic problem. We should be able to know something. You find that really the problem is that the unlimited healthcare wants with rapid growth in healthcare expenditure. That is one problem, the health economic problem that we are all battling. That all these health economies are rotating around, and all these problems that are really we are facing. One is unlimited healthcare wants with rapid growth in healthcare expenditure. Their expenditure is increasing, the wants are increasing rapidly also, or they're actually unlimited. So you see, it's a big problem. That's why health economics is it's a big issue, or the big aspect of health, and that's why we all have to understand. We need to know this so that we make right decisions for our nation. Another thing is also insufficient health sector resources. It's a problem. That is the health economic problem. Insufficient health sector resources. We talked about scarce resources already. And we said, I don't know, when we are talking about scarce resources, resources can be in terms of what? You guys, I mentioned the scarce resources. I highlighted on something there. Are we, if we are following the resources, healthcare resources, if we are talking about healthcare resources, for example, we are talking about what?
Healthcare can be in terms of professional skill, the healthcare personnel.
Huh?
I'm following seriously.
Meaning. And then also the problem, we have talked about the three key healthcare problems. The first we have mentioned, the second we have mentioned, the third is now choosing between ones we can afford given our resource budget. You see, sometimes go to the health center, and the fact is, like for example, sometimes people are suffering, they have these kidney diseases, they have you see, if you have kidney disease, there are people who go for transplantation. I hope we know in our community there are people who can afford that, but there are people who can only afford to take medications, to just be really managed at home, and they have no hope. They are choosing between ones that they can afford, given their resource budget. So it's a big problem. We would want everyone to receive really a fair or equitable healthcare services delivery, but you realize that it reaches a point that it's only the rich that can afford some things. But of course, people that don't have enough money will then not benefit from other services that they really need. So that's where the problem of choosing between ones we can afford, given our resource budget, comes in. And then differentiating the concepts. Economics is based on a simple problem. Resources are scarce and human wants are infinite or unlimited. Then also trade-offs. We shall talk about opportunity cost. Of course, the opportunity cost, the cost of the next best opportunity foregone, may not be in terms of money. How can I bring the aspect of opportunity cost in real practice? Let's say you add today is a Saturday. You might have had a program, let's say to maybe you wanted to go for some traditional marriage in your village. Then you add a lecture, the health economics lecture. So these were two things that came up. Even traditional marriage is for someone too close to you that you are supposed to attend. Then the lecture is also very important. And you know, sometimes it may be hard for you to catch up. And for you, you prioritized to come for this lecture instead of going for the other one, traditional marriage. So you realize that, of course, coming for this lecture became the opportunity cost. The cost of the next best opportunity foregone. So you weren't going for the other function because you valued this one more. There are reasons that you are attached to this one. That's why, because you knew it will increase on your knowledge, or it will help you to be a better person. The other one is just a social function. So you said, no, let me go with this. So the concept of opportunity cost is really what we apply in making decisions, or most decisions in our life. So of course, we are still going to understand that it's the value of foregone benefit which could be obtained from a resource in its next best alternative. Maybe the other ones were really two different things. I will bring one that we shall try to relate very closely. You have two things that are very close. You chose to do, let's say you had A and B, you chose to do B, because you realize that if you do B, it would be more work than doing A. So here we are saying the value of the foregone benefits. The foregone benefit would be A, which could be obtained from a resource in its next best alternative. The next best alternative used is using B. B becomes the next best alternative use. You chose B, and you found that you chose B because it will give you more benefit than you choosing A. If you add two decisions, if you make another decision, you have one decision A and B, and you found that instead of choosing to do A, it's good for me to choose to do B, because doing B will actually, if in terms of health, may give me even better health outcomes compared to choosing A. We are going to see some key examples down here. Of course, the aim is to choose activities where benefits outweigh the opportunity cost. Yeah, so no regrets. Hello, something that you will not regret even after choosing. You will feel like you have chosen something worth. In simple terms, that is the opportunity cost. It's really not always explicit, but the opportunity cost will always exist. It's not very clear, but it will always exist. For example, the cost of a male circumcision intervention is an alternative health intervention that you could have to implement with the resources. You realize that we said safe male circumcision will reduce the risk of acquiring HIV/AIDS through some means that we have always been told. That, of course, when the foreskin is removed, you realize that they say the virus will always hide itself inside there for some time. But when you have no foreskin, the virus will not have any place to hide. So at some point, you have reduced some risk. So it becomes an opportunity, of course. It's say you are just to use other interventions, talking to people, giving people these other safety measures. You find that a safe male circumcision becomes, of course, a better option also. So if you had two decisions to make, you're going for this because you feel like it will give an additional benefit. That's why you made that decision. For example, what is your financial cost of attending this lecture? And what is your opportunity cost? So the concept of opportunity cost may be really that confusing, but if you understand some of these decisions we make down there, you can really be able to understand these concepts very well. So that's it. As we continue, we need to really know the practical aspect around opportunity cost. Of course, we need to understand that opportunity cost of investing in healthcare interventions is best measured by the health benefits. Sometimes we shall talk in terms of life years saved, the quality adjusted years. That is why we talk of the QALYs, quality adjusted life years, or the QALYs, or the life years saved. Like, I mean, if you choose to make a given decision, let's say to do vitamin A supplementation, instead of just telling the community to eat a variety and eat well every time, but you realize that it would not be the best always, then you roll out vitamin A supplementation program. Of course, you realize that maybe this is a better decision because these children will benefit more from the supplement because they may have challenges benefiting directly from the food. So you realize that what you would have done, you would have saved these children from dying early, or you would have saved them from that is the life year saved. Then would have saved them from let's say some deformity. Let's say having night blindness. If you have night blindness, then you have problems in relation to the quality of your life, because you can be productive. So by doing that, we are therefore talking about the quality adjusted life years, the life that you have lived that has been of quality and productive because of an intervention that was rolled out that helped you. Let's say for this case, vitamin A supplementation, then you remain with a clear eyesight for long, because you realize without vision, you can't be that productive compared to someone with vision. So that is it. Of course, in health and supply, we can't talk about economics without talking about demand and supply. Of course, demand is how much consumers are willing and able to buy. So at any price. I will ask you this. We may set questions around this, around demand. What is demand? What is supply? Of course, when they are demanding for something, that means they are willing and able to pay for it at that price. So how much they are demanding for it can be determined by many factors. Of course, the price comes in. We are going to talk about the elasticity of demand and elasticity of supply. These are things in health economics that we can't miss out. So, of course, the factors that may affect demand can be population, really affected by the population, the income level, related goods that are really competing in market can affect the demand of a given commodity. And of course, alternatives. In healthcare, we have many alternatives. We have many related products, but of course, they are not allowed to advertise. But when you go to a pharmacy, they will tell you that, yeah, we have Panadol, we have Panadol Extra. Then they will tell you that Panadol Extra will work for you within 2-3 hours. But this other one, yeah, is more expensive. But we have Panadol, yeah, this may work within 5 hours. But they're all okay. So it's you to make that decision now, because you have related goods. So it can affect your demand for the what? The other. Then sometimes you may have alternatives. Maybe instead of buying Panadol, all these things, your doctor told you that you can actually just take water, and you let's say you had headache, till you'll have some relief. So that means you are not always going to be really trying yourself on buying medicine. That means if you have another alternative, you know that when you take water and rest, maybe you'll be fine. That will affect the demand for that commodity. Then we have taste, fashion, and expectations. These are really key factors that may affect demand. And any serious student will have to keep always noting this very clearly, because at some point this may be asked. Then we have supply. Of course, supply is can be related to the amount of really these goods and services that the supplier is willing to release in market, given the demand and the price. So you find that supply can be affected by, or can be influenced by the demand, can be influenced by the price. That's why when I say price, you realize that people who deal in produce, sometimes they buy produce at a low cost, then they will keep it until that time whereby the price increases, then they start supplying it into the market. It's a key, it's a good example. But of course, we can have really other examples with regard to supply in health economics. Of course, that's where we shall go to demand and supply graphs. You find that, of course, demand will depend on the price. As price increases, demand will reduce. You find that the higher the price, the lower the demand. I don't know how to show this since it is not full screen, but you can see I would have written somewhere so that you see, but unable to. But anyway, if you're seeing something, you should be able to note that somewhere there. Yeah, let me see. This may work for me. If you are seeing this, you can really see that the higher the price, when the price is up there, the demand will be here low. And when the price is here down, you can see the demand will go there and the demand will be high. Are you trying to see that illustration? You does?
Yeah, we are seeing it.
Great. Because this aspect of demand and supply is very important. So you can see if I go there, the price is there below 20 down there, somewhere there. Then you draw up to somewhere here. You find that the demand is at 12. But when you increase the price above this $20, above it somewhere here, you find that the demand, when you go down, demand is there just at 3. So you find that there is a problem. You find that demand is really influenced by price. How about supply? Looking at supply, let me see. Of course, these are very important aspects of health economics that we can't go without understanding. So let's see something here. Great. So supply is here. Is supply influenced by price? Of course, you see when the price is up here above 20, you'll find that for supply, it will also be at the top up there. The quantity down here is the quantity, I believe. Down here we are talking about the quantity. Down here they are just quantities, and here we have the price. So that means the supply, you see, when the price is high, the supply is high. When the price is low, the supply is low. Are you seeing that? As you people are in business,
Yes.
you know that really that is the rule. You wouldn't want to supply much when the price is low. So that's it about really demand and supply. So that's it about demand and supply. Let's proceed. So I didn't want to go into details here, but of course there is an aspect of surplus. There is producer surplus and there is consumer surplus. producer or consumer surplus, this box, the blue one, is high when the supply is high. Because when the suppliers supply more into the market, then the consumers will have more. In healthcare, let's say the government provide more healthcare services. That means we, the consumers, will have much to benefit. Will have more healthcare services to benefit from. If the government pays the healthcare workers, employees, healthcare personnel, buy the ambulances, we shall have a lot to benefit from. Not so should us. Are you getting how the consumer surplus comes? Judas? Are you there?
Yes. Yeah, I'm there.
You understanding the concept of consumer surplus? Why it is higher at, of course, higher prices the suppliers will supply, and the more the suppliers supply, that means the higher the consumer surplus. Not so?
Yes.
Yeah, so that is the aspect. Of course, the suppliers will only supply when the price is good. Now, when the price is low, down here, that's what we are calling the producer surplus. The producer will have their what? They will have their goods. More of it, that's why I talked of produce. Those who buy produce and the price is low, and then they first stock it. They have a lot of it for themselves, and they have the surplus. They have a lot of it for themselves, and how here for us, sometimes people are starving. That is why we shall at some point realize that we shall sometimes realize that even the food security in the world is caused by really such situations. Of course, also in this surplus, we shall realize that basically it's the difference between the price the producer is willing to accept for a good and the price that is actually received. And all this really leads to the producer surplus and the consumer surplus, the price that the consumers are willing to pay for it, and really the price that they pay for the service. And in an ideal world, the price set by the market would prevail. But because this is not, this is, let me, yeah. In our ideal world, we are saying that the price set by the market would prevail because this is where we maximize surplus. However, there are reasons why the market prices fail, even for healthcare what? Commodities. So we shall see that's down there. Let me see that you are able to look at this thing well, the elasticity of demand. You see, demand and supply, they are like an elastic material. That is why we talk about the elasticity of demand and elasticity of supply. And you definitely have to understand this. And it's a very important aspect of your study. Of course, right from price elasticity of demand, where we are saying the percentage change in quantity demanded over the percentage change in price. These things keep changing. The quantity demanded will be influenced by the price of the commodity. I told you about Panadol Extra in the pharmacy and Panadol. The quantity demanded, if you are given option, the other one is 2,000, and then Panadol is 1,000. You find that there are people who may not afford the one for 2,000, but it has better health benefits, but they will not afford it. So there will be change, and that percentage change can also be illustrated in form of price elasticity of demand. And then also, we always, as you are going to do, you are doing a Bachelor of Science in Human Nutrition and Diabetes, and you find that a very important aspect of your life will be in promoting health through nutrition, education, nutrition counseling, and dietetic services, research, and so on. But you find that at some point you're going to be telling people to adopt some health outcomes. Let's say consume oils that are highly, let's say, instead of consuming this is saturated fatty acid more, you are going to advise them to consume food rich in what? Unsaturated fatty acid. We are going to talk about the fish oils. You're going to talk about this olive oil and many other things, the omega-3 fatty acid. But you're going to realize one thing, that their healthier options are always more expensive. So how will that affect demand? So this is a clear indication of price elasticity of demand. The change or percentage change in quantity demanded over the percentage change in the price. It is clear that the percentage change in the quantity demanded will always be low when the price is high. But anyway, that illustration brings it out. So demand tends to be more elastic. On what basis? One is that the larger the number of close substitutes, that means demand will be more elastic for a given what? Commodity. If there are close substitutes, we talked about Panadol Extra, and we talk about Panadol. That is for my sister who is a nurse. And we talked about consumption of available. Let's say you have oils available there, and then consumption of health options, which are more expensive. People will always choose these other cheaper ones. So when you're always giving healthier options, consider the cost and try to give the healthier options that can really be obtained at a cheaper cost. So that is one thing. Close substitute, if the good is a luxury, because you want a phone, let's say in regards to phone, you want to access, you always want to attend lectures on Google Meet. You will not need to have an iPhone 15 Pro Max. You will just consider that a luxury. You will just need some Technophone there for you to access. So the other one, the good becomes a luxury. So that is also one thing that affects the what? The demand. Relate this to the healthcare commodities. That is a clear example of a good being a luxury. You can have one at a cheaper cost, and it will achieve almost the same functions you want. The other one may have extra functions, but the extra function may actually not be what you want now. Those are just luxury. If the more narrowly defined, like you have the market of a given commodity, it's really narrowly defined. Let's say this commodity is just for a group of people in the community. Let's say for children under 5. That is how narrowly defined the market can be. There will always be demand elasticity. Then the longer the time period in which a given commodity is in market can also make its demand more what? Elastic, not stable. So you will realize that sometimes the commodities stay longer in market and people get too much used to it, and people will want newer commodities, and when they are told that there's something out there that actually works better, they feel like they are too much used to what has been there, and they will definitely want to consider other options. So another thing is elasticity of supply. Of course, it looks the same at both extremes. And what affects the elasticity of supply? The ability of the sellers to change the amount of the good, and also the time period. Those are key things that affect the elasticity of supply. So are we still there? Do we have some questions until there? I welcome some questions to discuss a few things as we think of proceeding. Yeah, can we interact a little? Someone has a question?
I think it is very clear.
Yes. Are you sure? I hope. Are you sure that when we bring a paper, people are going to overpass? Because it's very clear. There should always be some question. I like it when people ask questions. That means they're critically following direction. They always have something that they haven't understood very well, and they want it to be clarified somewhere. Not so. Yes, 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 yes. Anything? We are all aware. Okay. If we are all fine.
It is okay.
Oh, that's great. That's great.
Ruma, my hands is up.
Oh yeah, you talk. Actually, I may not be seeing the hands.
Oh, okay. Okay, sorry for that. You were talking about the demand and the opportunity cost. It is very interesting
Yes.
topic, and we maybe some of my colleagues, including myself, have enjoyed it. You were relating it to some drugs, and then in a situation when the demand, demand sometimes cannot be only seeking teacher where someone wants to do it, but you will be post both extrinsic, maybe outside.
Mm.
Someone is sick, and the drug that is needed is the only option to buy. So in that health setting, what can a person do? Because there will be no other option that will be aligned to, because like many people are dying now, you'll be diagnosed having hepatitis and other things, but the referral pathway will be now from South Sudan. You need to go to, and the government may spend, maybe that person will be a government official, and the government may spend a lot of money, both transportation and all the things. Now the question is, I think most people have been referred to India, and the lot of money, dollars, has been spent. What could be the idea of the health professionals that who are in the health sector, instead of going for treatment in India, will it not be possible for the human resource or the human capital that they have to be given the priority? They are trained, they get the education and the food up the infrastructure, because with the limited resources, it will also be in health infrastructure, like the building where the hospital will be erected. Why is it not good for the government also to make sure the treatment they go for, instead of bringing those cadres in the country, will it not be part of the demand of a country to do it?
Oh yeah, great. It's a nice question. I like it when we are engaging in this level, because I believe one day we shall be faced with the same situation where we are at the level of decision making and we are able to make such decisions. Really, there's something we call health equity. Of course, equity in healthcare, we shall realize that it is when every person has the opportunity to attain their full potential of health and no one is at a disadvantage. Of course, this it has not been achieved really, I can say. It's worse in Africa that equitable access to healthcare service is still a big challenge. But in other countries, you find that many people or the population receive modest healthcare services. Now, it is really upon the government to prioritize or to set correct priorities. It is really upon the government to develop human resource, to develop facilities, to develop to buy the equipment, so that when we have the right human resource, when we have the right facilities, when we have the right infrastructure for healthcare service delivery, we can definitely provide healthcare, or the equity in healthcare service delivery can be realized. Because if we remain at a point whereby someone having a terminal illness will have to be flown outside the country to receive treatment, we shall realize that not every person can access such a health service, even if that is all they have. They will not access such a health service because not other person will have these resources to go to another country and spend in receiving such a treatment. You realize that sometimes it's beyond the cost of you staying in the health facility there. Let's say you go to India for a kidney transplant. You have to go with someone, you have to spend monies in the hotel room to be there waiting for this service to be delivered. That's why sometimes they put it really expensively. Sometimes, let's say, 50,000 US dollars, 100,000 US dollars. And sometimes it is really because of the governments. I think the challenge that sometimes the obvious decisions are not made, because if we put this infrastructure in our own countries, you find that someone from Rumbek, let's say, I don't know, the biggest city around there, Juba, let's say we have a very good healthcare system in Juba that can be really equated to, let's say, one in India, with all these specialists and all these people and a very big health facility in Juba. You find that someone can easily leave Rumbek to Juba to go and access some health service that they should have accessed in India. It may be cheaper because this is their own country. They might even have a relative in Juba, so that when they stay there, reducing the cost, but at last benefiting from the health care service. So you find that it becomes a little more cheaper to access the service by the general population that they could not access out of the country if the service is brought within the country. So that is it. It's an aspect of health equity, and it's very important. But all these decisions are always upon the government. Sometimes they have different priorities. It's always questionable in most cases. You realize that they may have enough money to do these things, but it's always not done. But I pray that some of you will be in the government, or you are in the government. You always have to make this decision to really help your nation. Of course, I've always told people that the white people seems to be living in heaven, but we the blacks, we seem to be struggling, yet we have everything. I think it's just a mindset. We need to, because I think they have good leaders who want everyone to benefit from the lead to the country as they have reached that point that they want to educate everyone. They have reached that point that they want everyone to be healthy. They have reached that point that they understand that people will have opinions, people will always make noise, but the answer may not only be to kill them, but the answer is always for the leaders to do the right thing. So it comes in health, it has implications. These are policy decisions and many other things. But why do we come to school anyway? We come to school to change our mindset. After hearing what I'm saying now, someone will have a different aspect or a mindset on how to make decisions. That is why education is very important. That is why we say education changes a nation. So that is it. Because you see those small decisions, they are really already affecting our service delivery or the LCC. So, a perfect, of course, in the full and perfect information, of course, in that competition, you find that everyone knows everything about all products in your community. You know all these healthy diets and all these things. That is in a perfect market, the health economy, where you are trading the healthcare services. You are able to provide information on healthy diets to people. You are able to provide dietetics services to people. So people know this information. Then the impersonal consuming the good is affected by it. They pay all the social costs and gain all the social benefits. Of course, there are goods that we say the private goods. The other, sometimes they are really luxurious goods. Then we have selfish motivation also in a perfect competition or perfect market. Utility gain from consumption is for the individual only, and suppliers just want to make the money. So some of these are just key aspects. Many buyers and sellers, free entry and exit, homogeneous product. These are just key aspects of what? For perfect competition, or what they call perfect market. So that may not be much focus. There is also what we call monopoly versus perfect competition. In the monopoly, there is always be in a market, there are people who want to monopolize the supply of a certain commodity. And we have to understand that we don't have competition in the market, even for provision of health services. You have health centers in your community, and there is always this one health center only. You find that they will be at ease to provide the services they wish because they know you have them only to be at any threat to do their best, because there is no competitor market. Because as we are saying, the invisible hands on the markets lead to an allocation of resources that makes the total surplus as large as it can be. Because the monopoly leads to an allocation of resources different from that in a competitive market, the outcome must in some way fail to maximize the total economic well-being. You can see in a competitive market, the distribution of resources, they are always, and that when people are competing, the other one will always want to focus on quality because they want to be better than another. But in a monopoly,